Apologies, I had forgotten to unmute, so I'll start again. Good morning, hello everyone, good afternoon, good evening, depending where you're joining today. And sorry, I had also forgotten to turn my camera on. Thank you for joining this webinar, and greetings also to those that will be watching later the recording. So today's webinar on the FIP Development Goal 15, People-Centered Care, is part of a larger series of events called Setting Goals for the Decade Ahead. So you're very welcome to join, and we have an exciting program ahead today. My name is Gonçalo Souza Pinto. I'm lead for practice development and transformation at FIP, the International Pharmaceutical Federation, and it is my pleasure to be the moderator for today's event. A few announcements and webinar rules. As I mentioned, this webinar is being recorded and live streamed via the FIP YouTube channel. And also the recording will become available not only on the YouTube channel as well, but also on the events website of FIP. So you're welcome to watch again or to watch from for the first time if you could not join today at the event, at the live event. If you have any questions to the panel, you can use the Q&A box that you will see on your menu, on the Zoom menu. The chat function that we have and the chat box, you can use that to greet other colleagues, but for questions to the panels, we prefer that you use the Q&A box so that we can log all the questions and address them at the various speakers. Thank you. On that note, the main goal of these events is really to present the Development Goal 15 and to discuss the mechanisms and how colleagues across all areas from practice, science, and education and workforce development can implement these goals. So we might not have a lot of time at the end for questions, but we will try to be brief in our presentation so that you will have the opportunity to send in some questions and we can address them. You're also welcome to provide any feedback on this webinar or other webinars or events organized by FIP by writing to us on this address, webinars@fip.org. And finally, we do invite you to become an individual member of FIP or a member organization if you are watching and are interested in joining. There's really a wealth of resources and benefits for our members, so we do encourage you to join. As I mentioned, this is a part this is the 8th episode actually in this series of events called Setting Goals for the Decade Ahead. And it's a comprehensive program of 21 events that will cover each of the 21 FIP development goals that were launched in September 2020. So this series will run from March to December this year, or from April to December, to cover all the 21 events. And the goal of these events, of course, is to mobilize our global pharmacy and profession and the sciences and academics and people working in workforce development to develop and transform our profession through this framework, which is the FIP development goals. And really we aim to engage the whole profession and members and colleagues all around the world in every region and country. And we will be providing the aim of these events is really to provide a description of each of the goals, the direction that they can be used to support, and the context for each of the specific goals. We will also be monitoring and evaluating the implementation of these goals through data and evidence, and share various resources across practice, science, and workforce and education to support the implementation of these goals. So this is an outline of the calendar of this series. We started in March, and we're now on the 8th episode, on 15. And as you can see, we will be running events until December, with September being a busier month with 4 events because it coincides with the World Pharmacist Day and World Pharmacy Week. So stay tuned. And the outcomes for today's specific event around the FIP Development Goal 15 on people-centered care is to describe and explain the components of this development goal and its three component elements, workforce and education, science and practice, to showcase some of the FIP tools, resources and work that we have been doing in recent times to support the implementation of this specific goals and or goal, and to identify priorities across practice, science, and workforce and education. And that's why we have invited experts in these areas to join the panel today. And finally, to engage our members in an activity to support monitoring and evaluating the goal through the data evidence. So we will be including a little activity where you can participate and help us develop a set of indicators to monitor and evaluate the implementation of this goal. This is our panel today. I will be introducing each of the speakers just before their presentations, but we have Tolu Ojibegson from the NCD Alliance. We have Isabel Jacinto from the National Association of Pharmacies from Portugal. We have Jack Chen from the Taiwan Society of Health System Pharmacists. We have Astrid Jock from, who is the CEO of an organization called Quali Care from Switzerland. And we have our colleague Anyeken Epignon, who is the practice transformation and project coordinator in FIP in our team. So we can have really no pharmaceutical care without a proper and adequately trained and sufficient pharmaceutical workforce, and we can have no pharmaceutical care without a scientific foundation for the decade ahead. So that's why we need to consider these goals in its three interlinked dimensions and elements, and they cannot exist with one without the other. And you may remember and you may know that FIP launched this set of 21 development goals, building on the existing 13 workforce development goals that were adopted in 2016, following the conference that FIP organized in Nanjing. And then they were expanded to 21 to include various goals that include in various areas of our profession, or that are essential for pharmacists to intervene in these areas, including the one that we are discussing today. This was one of the goals that was added. And each of these 21 have those three dimensions that I just mentioned. So I will just present a brief video. You may have watched it if you have been following this series, but it provides a description of these of the goals. So as you can see, there was a URL, a web page on the FIP website where you can really read more about all the goals. So today's goal is people-centered care. And this goal deals specifically with non-communicable diseases and long-term conditions. And the reason for the goal to be called people-centered care is that these conditions, we really need to engage with individuals on a one-to-one basis with a very people-centered approach, even before these conditions are established, because a lot of these conditions have preconditioning factors and risk factors that condition the development or lead to the development of these conditions later on in life. And therefore, we need to start even before the disease has actually manifested to prevent their appearance. So there's a role for pharmacists in this set of diseases that goes well before the disease is actually in place. So we need to have this people-centered approach in terms of prevention, and then screening, referral, diagnosis, follow-up, disease monitoring, optimizing medicines use, and monitoring the development of the disease and the disease state management, it's called. So it's really a people-centered approach throughout people's lives. And non-communicable diseases, also sometimes called chronic diseases or long-term conditions, they tend to be precisely long-term and last throughout people's lives, or well, not in all cases, but in most cases, this is what happens, and they can be the result of a combination of genetic and physiological and environmental and behavioral factors. And these are the four main areas of the non-communicable diseases as defined by the World Health Organization: cardiovascular diseases, chronic respiratory diseases, diabetes, and cancer. But it really also includes mental health conditions and many other non-communicable diseases. But these are just the main, the most prevalent diseases and the ones that require most of our attention. And these diseases also share a number of common risk factors, including physical inactivity, alcohol abuse, tobacco, and unhealthy diets. And so by really intervening at the level of prevention and coaching people to adopt healthier lifestyles and abandon these risk factors, we can be intervening, we can be leading people to healthier lives and preventing various of these diseases that I mentioned. At global level, the non-communicable diseases are responsible for over 36 million deaths per year. So it's really more than 60% of the world's deaths. And many of them, over 40% of these deaths actually take place and happen before the age of 70. So definitely they require a concerted and combined and synergistic effort by all healthcare professions and across the health system to address them. And what we've seen, also based on data from WHO, is that the burden of non-communicable diseases, if we compare it with data from the early in the 2000s and the estimations or the estimates in terms of their evolution until 2030, we can see that around the world, non-communicable diseases will grow from 47 to 57% of deaths, of the reasons for or the burden or the reasons, the causes of death, excuse me. And if you look at high-income countries, these are already the most prevalent ones. From 85%, they were already in 2002, and they are expected to grow until 90%. But also in low-income countries, this has been really where there is a bigger change, where infectious diseases were actually responsible for a majority of the deaths in the early 2000s, but that is changing, and NCDs are really increasing from 33 to 45% in low-income countries. So this is really something that is cross-cutting across all income levels and across all regions in the world, and therefore there's an important role for all health professions and and including pharmacists, to minimize the burden and mitigate the impact of these diseases. And this can be done through a variety of roles and at various levels of the disease process. So before the disease is actually established, still with healthy subjects, we have an important role in health promotion, in disease prevention, and then we have a role in screening the diseases in the community and ensuring that people who might have one of or various of the NCDs can be adequately identified in the community and referred to other health professions for diagnosis and for follow-up. So this is an important role as well, and pharmacies can have this role as a gateway to the health system, an entry point, and really raising awareness about the importance of screening in the community. And then when the disease is established and there's a diagnosis, we have a role to play in disease management, and through point of care tests and monitoring of disease indicators, and then also in optimizing treatments. But that's really enough from my side. So now I would like to give the floor to Ms. Tolulope Ojibezan, who is the Advocacy and Partnerships Officer at the NCD Alliance in Geneva in Switzerland. So Tolu joined the team in Geneva in 2019 to further develop NCD's alliance strategic relations with the World Health Organization and also with other United Nations agencies and member state missions in Geneva. She's also supporting the development of the NCD Alliance membership and partnerships across civil society, the private sector, and academia. And before joining the Non-Communicable Diseases Alliance, Tolu worked in both the public and private health sectors in Nigeria, her home country, and her most recent role was with the Secretariat of the United Nations Interagency Task Force for Non-Communicable Diseases. Tolu is a pharmacist by training and has just completed a master's degree in public health from the London School of Hygiene and Tropical Medicine. She also serves on the board of the African Forum for Primary Care, a civil society organization that consists of diverse multidisciplinary primary healthcare workforce stakeholders from across Africa, with a shared vision for primary healthcare delivery that is comprehensive, accessible, of high quality, and responsive and delivered by empowered healthcare teams. Thank you so much for accepting our invitation to speak today, Tolu. It's really our pleasure to have you as a speaker on today's event. The floor is yours.
Good morning, good afternoon, good evening, colleagues. Thank you very much for having me on the panel. I'm extremely humbled to be here today. I will just start by, first of all, acknowledging our brothers and sisters who have been at the front line of the pandemic. It's been a prolonged pandemic. It's been a tough journey. I just want to take the opportunity to say kudos to you. We salute your courage, and we hope that we never have to pay the sacrifices we're paying currently for any pandemic going forward. We hope that governments will take the important lessons and make sure that health workforce protection is priority, even as we go forward. Thank you very much for having me. If I may have the next slide, please. So I'll be speaking today on the topic, establishing and engaging in partnerships to deliver the NCD's mandate. I will be looking at how this relates to the pharmacy profession, but I think a proper entry point is to describe the work we do at the NCDA Alliance and how this relates to the global NCD mandate. So I'll start by explaining that, at the NCDA Alliance, we work with, we engage with 300 members who are currently located in 81 countries. So you see that global reach in the impact of the work we do. The work we lead at the country level is done through national alliances. You engage with governments, the health sector activists, and other stakeholders to really make sure that the impact of NCDs are taken into consideration in health system planning and monitoring and evaluation. And beyond these national alliances, we also work with a group we call supporters, and they are drawn from the private sector, from foundations, academia, and NGOs. And we recently also formed some partnerships with government development agencies, particularly those for Sweden and Norway. So you see that the work we do is guided by strong partnerships that, that allow us to work to the fullest of our capacity as a global civil society. And I also not fail to mention that we were founded in 2009 by 4 founding federations representing the 4 major drivers of NCD morbidity and mortality at that time. And they are the UICC, IDF, World Health Federation, and the Union. If I may have the next slide, please. And so basically, this is an overview of what we're trying to achieve as the NCDA Alliance. We dream of a world where everyone can live a healthy and productive life, and where they can be protected from the impact of non-communicable conditions, be it disability, be it death, be it stigma. We really do think that that such a world is possible, and we hope that you will join us in the work towards this vision. Our core values are people-centeredness, collaboration, equity, and all the other things you see on the slide. But I will quickly draw your attention to our strategic pathways. We have advocacy and accountability, capacity development for our teams at the country level and civil society, knowledge exchange, knowledge sharing, and finally, we prioritize partnerships. And I will dwell a bit on this because, it's important to always remember that the burden of NCDs is huge. It's not something that we can leave to government or civil society alone. We really do see the role for different stakeholders in the response to NCDs. And so we are really proud of the partnerships we have in place right now with academia, with UN agencies, with government agencies, with civil society. And we hope that you would also take this into consideration as you continue to shape your work on people-centered care and non-communicable conditions. And in case of interest, I would also like to share that we just launched a new strategy that will guide our work over the next 5 years. It very much takes into consideration the impact of COVID-19 on NCDs, on civil society, and on health systems. And so it's going to guide our work and pilot us through the difficult years that we have ahead, obviously given the impact of COVID-19 and the growing burden of NCDs globally. Next slide, please. Now, reflecting on the work we do as the NCDA Alliance, we very much tailor our goals as an organization towards 2 global mandates. And the first one I will talk about is the WHO 25 by 25 NCD targets. So these were launched in 2013, but they were called for during the UN high-level meeting on NCDs that held in 2011. And so governments agreed that there was a need to define clear targets for non-communicable conditions. And so there was a consensus on the need to reduce by 25% premature mortality from NCDs by 2025. And that's where the 25 by 25 title came from. But if you look at the slide, you see that there's some specific guiding actions that governments need to take on board to be able to achieve this 25 by 25 targets. And for each one of them, the role of pharmacists, cannot be overemphasized. And I know that tobacco cessation programs are very much based on strong pharmacy research, pharmaceutical medications, and there's a strong role for counseling, in these processes. So, within the 25 by 25 target, the role of pharmacists are clearly spelled out. And, I would encourage us to keep this also in mind, even as we continue to reflect on these global targets. When we look at diabetes, early diagnosis is key. And, we need to get to a point where we know that, NCDs are now the norm rather than the exception, and we need to be conscious of opportunities to proactively, screen our patients, to see if they have these conditions and guide them appropriately on the next steps if they do have them. So just to reflect on the fact that, for the 25 by 25 target, which is one of the global mandates that guide our work, the role of pharmacists cannot be overemphasized, across these nine action points on NCDs. If I may have the next slide, please. Following the adoption of the 25 by 25 in 2013, the SDGs came into limelight in 2015. And for the first time, there were all NCDs were introduced into the development goal. And we have the SDG target 3.4, which really mobilizes governments to work towards reducing premature mortality from NCDs by 1/3 by 2030. Again, we see clear role for the health workforce, including pharmacists, to really work towards this goal. There's the impact, there's a need for a strong workforce, in driving this mandate. So it's important that, we also take this into consideration. The SDG targets on NCDs cannot be achieved without an optimized health workforce, without an optimized pharmaceutical workforce. And the 25 by 25 also can only be achieved with an optimized health workforce, including pharmacists. So if I may have the next slide, please. So those are sort of the two mandates that guide the global NCD response. Those are the targets we're working towards as a global NCD community. And we've had some watershed moments over the past couple of years as the NCD community, beyond the targets in 2013 and the SDGs in 2015. There was a third high-level meeting on NCDs in 2018, and it was at that meeting that the core NCDs were expanded from the major 4 to now include mental health. So it went from cardiovascular conditions, diabetes, cancers, and respiratory conditions to mental health was added on. And then the risk factors, there was a 5th risk factor added in the form of air pollution. So we saw the move from the 4x4 approach to the 5x5 approach to NCD response. And then in 2019, there was the high-level meeting on UHC, and there was strong reference to NCDs in the political declaration from that meeting as well. So that's another major landmark in the global NCD response. And in the same 2019, Norway announced their strategy, which will drive NCD action in low and middle income countries, particularly to support the adoption of fiscal policies that can better protect populations from the impact of NCDs. And then in 2020, COVID-19 happened, and we saw another landmark moment when during the World Health Assembly, the impact of COVID-19 on NCDs was expressly referenced by member states. And there was also that call to action, for better protection of people from the scourge of non-communicable conditions. And moving on again to 2021, there were a couple of important resolutions at the just concluded World Health Assembly that held in May this year. We saw the adoption of the resolutions on diabetes, on social determinants of health, on mental health, and a couple of other important policies that we support NCD response going forward at the global level. And just in June 2021, there was a UN high-level meeting on HIV/AIDS, and there was strong reference to non-communicable conditions. As a matter of fact, governments agreed to better protect people living with HIV from NCDs. And going forward, we expect that HIV programs, HIV services would seek to incorporate non-communicable condition screening, diagnosis, and care in the services they offer to people living with NCDs. So those are some of the important progress we have made as a network, as a network of people living with and advocating for NCDs over the last couple of years. If I may have the next slide, please. Now, I've mentioned all these important points, but have they translated to the progress we'd like to see? Unfortunately, the answer is no, and the reasons are not far-fetched. I'm sure you are familiar with many of them. As a civil society, the NCDA Alliance supports a group of other stakeholders to launch what we call the NCD countdown. So it basically assesses every year or every 2 years, depending on the capacity, the progress made towards the SDG target 3.4. And the last of this assessment was published in September 2020. And what we found that although governments were making progress, the pace of change still remains too slow to achieve the SDG target 3.4. That was published in September 2020. And the same 2020, WHO published the Global Health Estimate. And, we saw that, NCDs now make up 7 of the world's top 10 causes of death. And if we compare this to 2000, there were just 4 of the 10 leading causes of death. So, while we have had all these watershed moments, they are still too slow to give us the kind of response we need for non-communicable conditions. Within the same year, we saw that heart diseases now still remain the leading cause of death at the global level, and they have been at this position for the past 20 years. Now, they are killing more people than ever before, and they represent 16% of total deaths from all causes. That's a huge statistics, if you have me. For every 100 people who die, from communicable conditions, road crashes, and all the other issues, 16 of them are actually caused by heart diseases, cardiovascular conditions, which is quite startling. Again, adult obesity is on the rise, with up to a quarter of some populations living with obesity in 2016. And I think the biggest shock for us was around diabetes, where we found that they have increased by 70% globally compared to where they were in 2000. So we've had these important landmark moments, but still the progress on NCDs is too slow, and many more people are dying, prematurely from non-communicable conditions. And I think the easiest way to put this into perspective is if you look around you, I'm sure everyone here knows someone who has died prematurely from non-communicable conditions. I know up to 5, but I'm sure you can put this into perspective if you do that simple analogy of the people who have died before age 70 from a non-communicable condition. Next slide, please. Now, in the midst of all of this poor response to NCDs, COVID-19 has imposed an extra layer of complexity. And this is actually straight from WHO. They have described the interplay between COVID-19 and NCDs as a deadly one. COVID-19 is driving many cases of undiagnosed NCDs because, as we may have noticed, even within our practice as pharmacists, services for NCDs have been disrupted to make room for COVID-19 response at the country level. Governments have had to reallocate the health workforce to support the response to NCDs. But the collateral damage for that is that more people are living with undiagnosed, non-communicable conditions. Those who have diagnosed NCDs are missing their appointments, surgeries are being cancelled, and there's a lot of disruption in essential services for preventing and controlling non-communicable conditions. And many more people are unprotected. People have been forced into lockdown. They've not been able to exercise. They've been exposed to the unhealthy activities of unhealthy commodity industries, through relentless marketing of unhealthy products. So we see so many forms, so many aspects of the COVID-19 response driving, the global NCD pandemic in the wrong direction, unfortunately. Next slide, please. And this helps us to put this, what I've just described into better perspective. There was a survey conducted by WHO again in April 2021. And as at that time, 85% of countries still reported that some of their Ministry of Health staff who were previously responsible for NCDs had been deployed either full-time or part-time to support the COVID-19 response. We know what this means in terms of, being able to monitor NCD progress, NCD work, NCD services at the country level. Apart from these, 19% of countries reported that some funding had been allocated to the COVID-19 response. And, 52% of countries have had to postpone one or more NCD activities to be able to make room for COVID-19 response. And these are extremely important initiatives that would have made a difference for people living with or people at the risk of non-communicable conditions. So we see these are some of the many factors that are driving the NCD pandemic at the global, regional, and at the national level, even as we speak in 2021. If I may have the next slide, please. Now, in 2020, just before the pandemic broke out, as a civil society, we took the time to reflect on the journey from 2015, when the SDGs were adopted, to 2020, that we saw that it had been a 5-year span, and we were like midway into the SDGs. And we thought it was a good opportunity to reflect on the journey so far, to be able to identify areas where we can scale up action immediately to impact on NCDs. And following review, following consultations, following extensive meetings with stakeholders, we identified 5 major gaps in the global NCD response that pharmacists are also particularly positioned to act on, to scale up action on NCDs. We saw that there's major gap in leadership. Many governments are not prioritizing NCDs as they should be. And if we look around us, we can tell that for NCDs, it's been a bit of a struggle. Many of the things that are driving them lie in sectors that are outside the health system, outside the health sector. So we see a need for multi-stakeholder coordination mechanisms at the country level that governments need to lead to drive action on NCDs. And we haven't seen this in many countries. Governments have led the work of NCDs to civil society, and with very limited influence from government in many cases. And we also saw a care gap. Like I said earlier, services have been disrupted. In some cases, the essential services for NCDs are not included in UHC benefits, unfortunately. And we know that they are chronic in nature and have the tendency to drive people towards poverty, because if they are chronic, they are constantly needed. And when people pay out of pocket, there's that risk of poverty. So we saw the need we saw the care gap in NCDs as something we needed to highlight for stakeholders, to consider going forward act on NCDs. We also saw the accountability gap. Governments have made commitments in 2011, 2014, and in 2018 through high-level meetings on NCDs. But these commitments have not translated to action at the country level. So we saw that accountability gap in the global NCD response. We also saw major investment gaps, despite the fact that NCDs are the leading cause of death globally. The funding of them is quite poor, with more and more funders looking towards communicable conditions. And I am sure COVID-19 helps us to also put this into perspective. Billions have been mobilized so far for COVID-19. Well, it is actually going at the same time with the NCD pandemic, which is also of even greater scale. So, there are major investment gaps around the global NCD response. And then finally, we saw the need for stronger community engagement. We saw that, there's a need for more people to know about NCDs and to understand what they can do to better protect themselves and their communities from NCDs. And I will just maybe reflect again on, these 5 gaps and highlight that for each of them, pharmacists are particularly well placed to act on them, even as we act within our mandate as pharmacists. I know that we engage with leadership already, through at the national level and at the global level. So we should, we could aim to to support them to prioritize NCDs in their planning, in their policy meetings, in their health agenda, even going forward. We are also well placed to act on the care gap and the accountability gap. We know this commitment that have been made, for health system strengthening, for UHC, for NCDs. We can actually hold governments accountable by asking them, what have you done? How can we help you, to scale up action on NCDs, even at the global and national level? So I'll just move on to the next slide now to save some time. And so I just added some of these points to help us put into perspective some of the things that we can do as the community of pharmacists. It doesn't matter whether we're in the research or the industry or in the community pharmacy practice. There's actually an opportunity for us to, first of all, amplify the needs and the views of people living with NCDs. At the core of our work at the NCDA Alliance is the need to amplify the views of people living with NCDs, because they are the ones experiencing these conditions and they know what they need. So until we bring them in, we usually say nothing for us without us, nothing for them without them. So let's make sure that in the course of our work we take on board their views, their voices, their needs, to better support them through what they're experiencing, as people living with NCDs. Pharmacists can also lead and support multi-sectoral partnerships on NCDs. I mean, for example, now we've seen how the world has rallied around to drive the COVID-19 vaccines production. I believe that obviously there's a strong pharmacy component in everything that was done, from research to distribution chains to even administration. And that's one of the strengths we have as pharmacists globally. We can actually lead some of the collaborations that we need to see, even to scale up action on NCDs. So let's be bold, let's engage governments on the gaps we see, even within our practice, and seek out partnerships that can help to address them. That can help address them going forward. Pharmacists can also call for integrated people-centered care. And this, at the core of this, is the need for high-quality primary healthcare systems. And we know that there's a need for strong PHC systems. Without them, we'd pretty much be going around in circles. So let's support the call for primary healthcare. Let's support the call for strong health systems. Let's support the call for people-centered care, which see people as equal partners, as people who have rights to their health in health system planning going forward. And then we can also seek to address gaps in access to affordable and quality NCD medicines, and not just medicines and diagnostics, particularly for non-communicable conditions. We know that many medications are available that can actually help to control the conditions, but access is still an issue, particularly in low and middle income countries. So I encourage pharmacists to seek out opportunities to partner with governments, with UN agencies, with civil society, to find ways to address these major gaps in access, particularly for easy to manufacture medications that are relatively available, but not accessible, potentially due to issues of funding at the government level. And then another thing is around the skills and competencies needed for managing non-communicable conditions. Like it was mentioned earlier, there's a continuum of care that is needed for non-communicable conditions, from health promotion, which supports prevention, to early diagnosis, which supports, being able to have a better prognosis for NCDs, all up to the point of treatment and management and palliative care in some cases. So it's important for pharmacists to understand this continuum of care and see their strategic role as stakeholders in the care for people living with NCDs. And I think this also, it ties closely with the next point on training and empowerment. We should say that our curriculum as pharmacists recognizes this continuum of care and empowers us to be able to act on them, depending on where we are in the health workforce going forward. And this is an overview of some of the things that we can consider, to scale up partnerships and engage on non-communicable conditions. The next slide, please.
Just for the sake of time, I will need you to wrap up in a couple of minutes, okay, so that we have time for the other speakers. Thank you so much.
This is my last slide, actually. The next is my thank you slide. So thank you very much for listening, everybody.
There you go. Yeah. Thank you so much for such an interesting presentation, such an engaging overview of the situation with NCDs and the impact of COVID in the global management of NCDs as well, which is, of course, a big wake-up call. So thank you so much for that, Toru. Really great presentation. So we will move on now with the presentation of the three elements under the FIP Development Goal 15, People-Centered Care. And we'll start with practice, with how this goal can be used to provide direction to pharmacy practice. And the element of pharmacy practice under FIP DG 15 is really about collaborative interprofessional strategies and people-centered professional services to support the prevention, screening, clinical management, and therapeutic optimization of NCDs and long-term conditions, including, as we have mentioned, cardiovascular conditions, chronic respiratory conditions such as asthma and COPD, diabetes, cancer, mental health conditions, dermatological conditions, and others, but of course focusing on those that have been mentioned before. So the mechanisms under this goal include to develop and implement structured and evidence-based disease prevention, including secondary prevention strategies and professional services for NCDs, to develop and implement structured and evidence-based strategies and services for the screening and monitoring of these diseases, and appropriately referral to other colleagues based on the identification of red flag symptoms, clinical signs through point of care tests and other services. Also, to develop services and structured systems and protocols for the referral, for the effective referral of colleagues, so that patients that are identified as potentially needing follow-up by other health professions can really we're not losing out, we're not missing out on those patients from the identification of a risk situation at the pharmacy and the rest of the health system. We need to develop effective systems of referral and follow-up. And also the same for the optimization, disease state management and the optimization of treatments and medicines used by people living with non-communicable diseases, which is of course important because they will be using these medicines for a long time, and we need to ensure optimal clinical and quality of life outcomes and resource utilization. And finally, to develop and implement structured and evidence-based strategies and services for special populations, populations of people living with long-term conditions and specific needs, such as older adults, people with functional diversity, rare disease patients, poor and vulnerable patients, illiterate patients, migrant populations, refugees, and other groups. So it is now my absolute pleasure to introduce Ms. Isabel Jacinto. Isabel was the chair of the FIP, with the former working group on non-communicable diseases that conducted a survey on this topic and produced the FIP reference paper, Beating NCDs in the Community, that was published in 2019 and is openly available on our website. And also this reference paper was followed by an FIP statement of policy on the role of pharmacists in non-communicable diseases. Isabel is the Executive Director of the Graduate School of Health and Management at the National Association of Pharmacies in Portugal, with several responsibilities that include managing and coordinating the development of professional training areas and events for pharmacy teams and other health partners, contributing for the qualification and continual improvement of health professionals' intervention areas. So it is my pleasure now to give the floor to Isabel. Thank you very much.
Hello, everyone. Thank you, Gonzo, for the introduction. As Gonzo said, my name is Isabel Jacinto. I'm a pharmacist in the National Association of Pharmacists from Portugal. I was the chair of the working group on the role of pharmacies in non-communicable diseases. First of all, thank you for the opportunity of being here to share with you how community pharmacies may contribute to the management of NCDs. Pharmacies are a relevant and valuable health resource in the fight against NCDs. Pharmacists represent access, the most frequently visit health professional, available to entire population, long opening hours of operation in pharmacies, ensures safety and quality, high training and education standards for primary care services. Pharmacists have regular interaction with patients, even with those who do not see their physician. These interactions can be used to improve the prevention of NCDs, the access to care, the responsible use of the drugs, and the adherence to treatment. Pharmacists are able to perform more relevant activities in the healthcare teams, boosting prevention, providing early screening and point-of-care testing, specialized counseling, and long-term disease management. Pharmacists could play a bigger role in NCDs, providing health outcomes by reinforcing health system cohesion while facing NCDs challenge. Next slide, please. Community pharmacies offer many opportunities for public health and disease prevention activities. Pharmacies have developed their strategy as a prevention and treatment center with services in the field of prevention, early detection, and treatment. Pharmacists and community pharmacies are ideally placed to be involved in tackling NCDs and to help support health system with earlier disease prevention, especially with interventions such as tobacco cessation and weight management, diabetes and cardiovascular disease, and promoting healthier lifestyles. Pharmacies led screening programs targeting high-risk individuals, ensure appropriate resource management in healthcare system through symptom assessment and point-of-care measurement for adequate and timely referrals to physician. Next slide, please. Community pharmacies are involved in early detection or diagnosis of NCDs to some extent the most countries and territories. Cardiovascular disease and diabetes are key areas for community pharmacies. For example, to slide, blood pressure measurement, it represents 70%. And blood glucose, 61% of detection methods used by community pharmacies. Next slide, please. Pharmaceutical care is defined as the contribution of pharmacies to the care of people to optimize the use of medicines and improve health outcomes. Pharmacies can encourage preventive measures, support adequate prescribing, and improve patient adherence to and safety of treatments, both pharmacological and non-pharmacological. Better adherence benefits patient, health system, and manufacturers and doctors. Pharmacies-led medicines adherence needs to be prioritized, both in terms of treatment outcomes and the economic consequences of non-adherence, highlighting the need of pharmacists to consolidate their role in this area. Community pharmacists play a key role in promoting the responsible use of medicines for NCDs, adding to patient knowledge and ability to manage their therapy autonomously or with the support of caregivers. Pharmacists have a crucial role in the therapy management, including medication review, assisting with correct use of devices, and disease management programs. Patients can play a major role in managing their own health and preventing NCDs, and pharmacies can actively encourage patient and caregiver engagement and empowerment through education. Next slide, please. Some examples for community pharmacies intervention in cardiovascular diseases, control and reduction of systolic and diastolic pressure, reduction of cardiovascular risk, improvement of blood lipids, improved medication adherence. And this kind of intervention promotes reduction of associated costs to treat cardiovascular patients. Next slide, please. Some examples for community pharmacies intervention in diabetes. measurement of weight and abdominal circumference, reading and interpretation of laboratory tests, monitoring of hypo and hypoglycemia, blood pressure control, education of patient in the use of equipment such as glycemic monitors, insulin administration devices, at all. Assistance in the correct use of injection techniques and improved medication adherence again. Next slide, please. Pharmacy's intervention in asthma management include first, patient assessment. For example, check the technique of inhaler use of asthma relief medication to identify cases of poorly controlled asthma. And second, education and support to facilitate self-management. Studies have shown that pharmacy's intervention can significantly improving the patient's inhalation technique, improving asthma control, reduce emergency visits and hospitalizations, reducing asthma-related healthcare costs. Next slide, please. Cancer drug therapy is often complex with many medication-related adverse events. Pharmacies are well placed, thanks to their education and training, to assist in the management of chemotherapy and its long-term effects. They can help in treatment of medication-related adverse events and minimizing risk associated with treatment. Studies have shown that the involvement of pharmacies significantly improves quality of life, preserve physical health and social relationships, and can reduce anxiety in cancer patients. Cancer treatment often results in the prescription of additional therapies to control adverse events, including both short-term and long-term drugs. Next slide, please. In conclusion, all the various sectors, civil society, professional association, private sector, are co-responsible for NCDs prevention and control. We can only reach our goal if everyone understands the importance of this matter and is available to communicate, cooperate, and contribute all together. It is essential to develop strategies that address the root of the problem, impacting all generations and changing their lifestyles and inadequate behaviors that have been consistent over the years. All the members must be brought together by common and collective activity regarding this matter. So the message should be clear and consistent, so we can all be working together to achieve a greater common goal. The message will not be effective enough if each sector works alone on their own. Professional associations also have a crucial role to play, not only by promoting new professional roles and services, but also by defining competency frameworks, use the workforce development, and by fostering interprofessional collaboration for better patient care. Community pharmacies may be generally in the private sector, but they offer available public service, and their role in NCDs prevention, screening, and management can greatly contribute towards the same goals as public health system. Next slide, please. Pharmacies are valuable resource in healthcare system. Pharmacies play an important role of primary care healthcare network, providing early screening and testing, advanced counseling, and long-term chronic disease management, meeting the needs of the population and to improve health outcomes. Last but not least, NCDs create new health challenges and need new health answers. Pharmacists and pharmacies are already committed with the future of health systems. Thank you for your time.
Thank you so much, Isabel, for this excellent presentation. There's really a lot that community pharmacists can do at various types of and levels of intervention in the area of NCDs. But you know, pharmacy practice, we work in different settings and in different areas of practice. So we have also invited our colleague Jack Chen to provide some perspectives on the roles that hospital pharmacists play in delivering people-centered care in the area of non-communicable diseases. Dr. Jack Chen is the Secretary General of the Taiwan Society of Health System Pharmacists. He holds the position of the Division Director for Clinical Pharmacy at the Department of Pharmacy, China Medical University Hospital in China, Taiwan. He is also an assistant professor of pharmacy at the School of Pharmacy in China Medical University Hospital in China, Taiwan, and obtained his Doctor of Philosophy in Social and Administrative Pharmacy from the University of Wisconsin Medicine School of Pharmacy, with a concentration in pharmacoeconomics and health service research. So, Jack, it is our absolute pleasure to have you on this panel today, and the floor is yours. Thank you very much.
Thank you. Hi, I'm Jack Chen. It is my pleasure sharing the hospital pharmacy perspective on this very important topic. In this slide, you can see that among the 5 mechanisms for the practice element of DG15, I want to highlight the following key points, which are very crucial while implementing the people-centered care at the hospital. In the second mechanism, we should develop the services by utilizing the assessment methods like structured tools and questionnaires to help us identify individuals that require further care. Also, we should develop a system for referring potential patients to other healthcare professionals and sharing clinical findings, and if possible, even sharing patients' health records. And then, of course, we should optimize patients' treatment and medicines to ensure optimal clinical and humanistic outcomes. Finally, we should develop the services for special patients population, especially for those with long-term conditions and specific needs based on the inclusion criteria. Next slide, please. Here, I want to particularly introduce the Basel Statement. The Basel Statement was first developed during the 2008 FIP Congress in Basel, Switzerland. It reflects the vision of future hospital pharmacy practice. There are 65 statements in total. I select 3 statements which are very relevant to the people-centered care and are also correspondent to the previous mechanisms in the practice element of DG15. In the 8th statement, it mentioned that hospital pharmacists should monitor patients taking medicines to assure patient safety, appropriate medicine use, and optimal outcomes for inpatient and outpatient. Since resource is very limited, we should establish patient selection criteria to guide pharmacists' monitoring and interventions. In the 27th statement, it mentions that hospital pharmacists should be an integral part of the multidisciplinary team for therapeutic decision-making. In the 28th statement, it is about that hospital pharmacists should promote seamless care by contributing to the transfer of information about medicines whenever patients move between or within healthcare settings. The Basel Statement gives us great guidance in providing patient-centered care. Next slide, please. I want to share Taiwan's experience in developing a national program adapting idea of the people-centered care. In many Asian countries, patients have the tendency going straight to the hospital outpatient clinics to seek medical treatment. There is no gatekeeper stopping patients from visiting multiple specialties across clinics. So there is a need to develop a patient-centered integrated medical care program. This care model involves multidisciplinary team, including prescribers, pharmacists, case managers, and of course, patients and their caregivers. The process has 7 steps. It starts from including the older and the vulnerable patients with multiple chronic disease and polypharmacy issues. Then second, we assess patients by using medication use evaluation and a comprehensive geriatric assessment. In the third step, based on the assessment result, we define the goals of intervention for the specific patient. In the fourth step, we then use Beer's criteria to identify potentially inappropriate medicine and then decide which medication should be stopped or started. In this fifth step, it should involve physicians and the patients. To ensure the success of integrated medical care, in sixth step, all parties' consensus on treatment plan are very important. Many times, we even have to bring in the patient's family members in order to reach the consensus. Finally, we have to monitor and adjust patient treatment outcomes regularly to ensure patients get the most of benefits from this integrative medical care program. Next slide, please. In the published literature, we prove that patient-centered integrated medical care program is cost beneficial and can improve patients' quality of life. However, when we provide the integrated medical care, we notice some challenges. For example, pharmacists don't have enough time. Since the process of integration is very time-consuming, we could only serve maximum 50 patients per month at one hospital. And then the number has been dramatically decreased during the pandemic outbreak. We also noticed that there is a discrepancy of care while transferring patients between hospital and the community. Sometimes we may have different views on patients' pharmaceutical treatment. If we do not discuss closely in advance, we may give patients conflict information. This may be also caused by incomplete electronic medical record transfer between different settings. Finally, the healthcare at the hospital become very disease-specific nowadays. There is a need to integrate those disease-specific care programs in order to provide a holistic and a patient-centered care. That's all my presentations. Thank you. Now go back to Gonzalo.
Thank you very much, Jack, also for providing this excellent overview of the multiple roles that our colleagues working in the hospital pharmacy setting can offer through their valuable services and to the management of non-communicable diseases. So thank you very much. And we will now present very briefly the science element, and we don't have a specific speaker to address the science element of Development Goal 15. Among the 21 development goals, some of them have, although there is a practice, science, and workforce element in each of the 21 goals, the weight, the relative weight of these 3 elements in some of the goals is not equally distributed across all of them. Some have a stronger, for example, workforce component. And with this one, with people-centered care, it's that the elements of practice and of course the workforce component that leads to the delivery of services are the strongest ones. So we'll just very briefly present the science element of DG15, which is about the capacity to monitor and understand health-related characteristics, leading to innovative, personalized approaches for improved people-centered care. And some of the mechanisms included under this goal include the promoting the provision of science-based medicines information, collaborating with stakeholders to make available the latest of relevant scientific information, and supporting the development of new medical products to meet healthcare needs, and also to collaborate with global organizations and stakeholders, including the WHO, to develop strategies for repurposing licensed medicines for other conditions. And finally, there's a point which is about practice-based research to collect data and produce knowledge about the impact of pharmacist interventions in the area of non-communicable diseases. So this was very briefly the science element, and it is now my absolute pleasure to introduce Dr. Astrid Jock. Astrid has a Master of Pharmacy and a PhD in pharmaceutical chemistry, working on morphine derivatives from the University of Vienna in Austria, and also worked in R&D of new oncological treatments in the United States. She's also the CEO of QualiCare, a Swiss non-profit association, which is a stakeholder platform aiming to increase the quality of care for patients with non-communicable diseases in primary care by interprofessionally elaborating national best practices and piloting the implementation in the primary care setting. Currently, the main topics that this association is focusing on are multimorbidity, vaccinations for people with NCDs, as well as the treatment of diabetic foot syndromes. Astrid has also works for the Swiss Society of Endocrinology and Diabetology, where she coordinates the Society's Commission for Postgraduate and Continuous Education, and she's involved in the creation of a postgraduate certificate for the treatment of obesity in adults, as well as coordinating several working groups such as disease management and diabetes for diabetes or diabetic foot. She's one of the 3 FIP global leads also for Development Goal 8, working with others. So as you can see that from this experience and career path, Astrid is ideally placed to participate in this panel and address the workforce and educational element of Development Goal 15. Astrid, thank you so much for joining us today on this panel, and the floor is yours.
Thank you, Gonzo. Thank you for the introduction. Hello, everybody. Good morning, good afternoon, or good evening. I am going to talk about the workforce and education element. To achieve optimal patient-centered care, we need strategies to develop the necessary workforce to care for patients with chronic diseases. With the scientific and technological advancements, many lives can be saved and people can age having a good quality of life. Unfortunately, this demographical development also comes with new challenges as the aging populations give rise to chronic diseases globally. In Switzerland, about 50% of all over 60-year-olds have at least one chronic disease. To provide optimal care for these patients, the workforce has to be trained accordingly, and a new mindset is necessary to meet further challenges such as the lack of medical staff and rising health costs. With the arrival of digital tools, more patients get interested in their health management, and the workforce needs to integrate this change. Next slide, please. Patient-centered and coordinated interprofessional care is becoming more and more important, and we need to invest today for tomorrow. QualiCare brings together representatives of professional bodies of different healthcare providers, insurances, patient organizations, cantonal authorities, e-health, logistics, edtech, and pharma industries, as well as specialist societies. Our experience shows that all stakeholders need to be involved in the creation of interprofessional frameworks, clinical checklists, and algorithms, and this from the beginning. The creation alone is not sufficient. The frameworks often land in the drawer. They have to be tested in pilot projects for practicality and implementation into the daily workflow. To show the impact of their use, the pilot projects also need to be scientifically evaluated. Last but not least, the involved healthcare providers need to be trained to use them as well as to provide interprofessional care and breaking down the care silos, just what Isabel also has been talking about in the practice section. Next slide, please. To be able to provide interprofessional care, healthcare professionals need to be able to collaborate. And interprofessional collaboration is new to many, and today's workforce has to learn to work with others from different specialties and with different competencies. To work together requires to have learned together. Many say they already work together, but often one person is the boss and decides, takes all the decisions. In true interprofessional collaboration, the lead shifts depending on the required expertise, and everybody respects the expert's decision. In order to trust one another, we need to know one another's competencies. A good possibility is to do internships in another professional setting, such as a pharmacist working at GP office or vice versa. Patients are often forgotten in this collaboration. We need to shift from working with a patient in the center to working with a patient as a partner. Healthcare professionals need to learn to communicate in the appropriate language with other healthcare providers, but also with the patients. And this fact is often underestimated. Next slide, please. To learn and work together is important, but in order to provide optimal care for chronic patients, we also need to abide to fixed quality standards. All professional postgraduate educations in Switzerland are accredited by the federal government, whether the professional education is at a university, college, or higher education level. All medical professions are subject to the same quality standards. And also the federal postgraduate specialist titles are governed by the professional bodies and accredited by the federal government. Interprofessional education is an important issue in Switzerland and supported strongly by the professional bodies of the general practitioners, pharmacists, and nurses. With many aging family doctors not able to find young successors for their practices, new interprofessional collaborations are formed. With the reinstallment of pharmacy education at a master's level at the University of Bern, the university created a common chair which is held 50% by a family doctor and 50% by a pharmacist. This development is very attractive for pharmacy and medical students and puts the other universities in Switzerland under pressure to follow suit. Next slide, please. Beside the national strategy of NCD 2017 to 22, the Swiss Parliament decided to add an article on the quality and economic efficiency into the health insurance law, which led to the creation of a federal quality commission with 15 members, 2 of which represent patients and people. In order to obtain funding for projects in the practice setting as well as in the clinical setting, patients are required to be on the advisory board, and often researchers in the clinical setting are unsure as to how to involve the patients into the project. Patients' expertise is often underestimated by many, but they contribute important aspects to research. In practice projects, evaluation methods mostly combine quantitative and qualitative methods, while not only asking for patient satisfaction, as this depends on the patient's expectations, but in particular asking for the patient's experiences as well as the outcome. Next slide, please. As mentioned earlier, frameworks need to be created interprofessionally, including all relevant stakeholders as well as the patient. To use these frameworks, the stakeholders need to be educated interprofessionally, define their roles and interfaces according to their respective settings, as well as learning each other's competencies. When we first decided to create national guidances for the treatment of the triage of the diabetic FIP syndromes, the diabetologists asked me why I proposed a pharmacist for the working group. And they did not know that pharmacists often see open foot wounds in patients, and the pharmacists too need to know what to ask the patient what to do and at what point to refer the patient to whom. Next slide, please. We create our national treatment pathways interprofessionally based on international guidelines and validated by all involved national professional societies. This validation is key to have all professions use and promote the same treatment. An interprofessional working group, including a patient and a caretaker, prepared a clinical recommendation for multimorbid patients, which QualiCare will pilot in 3 regions in Switzerland. I was part of this working group. The patient back then was not happy with the word multimorbid as it sounded like death to him, but the working group decided to stick to the official wording from the health ministry. The patient in our steering committee for the pilot project again expresses reservations to have the word on the health card, which we created, and we changed the name as we wanted to use have the patients use this health card. For the development of a treatment pathway, the patient is very valuable as only he knows his path through the healthcare system, which is often quite challenging depending on the complexity of the required care. For the diabetic foot syndrome, we developed guidances for the different care levels, with primary care as the most important, as patients too often arrive too late to a specialized foot care center and risk an amputation. Here, the pharmacists have a very important role, not only in providing care and referring, but also in screening, just as Isabel already mentioned earlier. One often not considered but essential screening measure for diabetic patients is the annual testing of their foot sensitivity. This is often forgotten also in primary care settings, as in GP offices, as our projects on diabetes show. To learn more about the diabetic foot, I invite you to the special FIP webinar on July 28th. Next slide, please. And in conclusion, I would like to say, in order to provide optimal people-centered care, the mechanisms written out in the FIP development goals handbook summarize the requirements for their workforce. People-centered care components should be integrated in competency frameworks across all stages of the workforce development. Into the initial education and training, which is DG1, as well as working with others, DG8, the early career training, DG2, as well as advanced and expert developments, DG4, quality assurance, DG3, as well as monitoring workforce impact, DG11. Only when these competencies are obtained in education can pharmacy workforce contribute to people-centered care in practice and science. And next slide, please. Thank you for your attention.
Again, thank you so much, Astrid, for such an important presentation, not only about the skills and the competencies that are required to deliver such services, but also for bringing up that perspective of the person with the lived experience of NCDs and how important it is that to consider this person as part and their interests and their perspectives in the management of their condition and their treatment throughout life. Thank you so much. So we now move on to our final speaker, who is my dear colleague, Anyeken Ekpenyong. Anyeken is a pharmacist from Nigeria, currently working with FIP as the Practice Transformation Projects Coordinator. In his role, Anyeken coordinates the FIP Practice Transformation Program on non-communicable diseases, which is aimed at supporting FIP member organizations to introduce changes to pharmacy practice in response to priority healthcare needs related to cardiovascular diseases, diabetes, asthma and COPD, cancer, mental health, and other NCDs. So it is my absolute pleasure to introduce Anyeken and invite him to take the floor. Thank you very much.
Thank you so much, Gonzo. Thank you for having me on this panel. I will just be talking briefly about FIP's work on non-communicable diseases, just walking you through what FIP has done. So basically, FIP supports our member organizations by providing tools and resources for them to be able to carry out services that aims to reduce the global burden of non-communicable diseases. For instance, in 2011, we produced, next slide. For 2011, we produced a publications to help our member organizations to provide quality diabetic care services. Then in 2015, we produced and developed a resource on mental health to help pharmacists provide mental health services. And if you look at it, mental health has now been added as a non-communicable diseases by the WHO. So we've already produced a resource to help pharmacists provide better care and quality services in this area. Then in 2015, we produced another report on tobacco-free communities to help our pharmacists to provide smoking cessation services and services that will help patients reduce their intake of tobacco. And as we've known, tobacco is very important. It's a very important risk factor in non-communicable diseases. So we are supporting our member organization through this toolkit to be able to provide a resource of services to help promote tobacco-free communities. Then in between 2016 to 2019, we really had a focus on NCDs. As Gonzo mentioned earlier, we established a working group on non-communicable diseases, and this working group on non-communicable diseases produced 2 reports. One was a survey report to kind of really understand the role of pharmacists in non-communicable diseases. That was in 2017. Beating non-communicable diseases in the community. The paper actually shows the evidence and best practices of what pharmacists are doing globally to reduce non-communicable diseases. And I would really encourage you to go to FIP website to download these resources. We also had the FIP statement of policy to kind of really renew the commitment of the profession to promoting NCD services in the community. Then in 2020, that was last year, we produced 2 resources. First one was a global survey report on air pollution to kind of really understand pharmacist awareness about air pollution and what the different roles and services pharmacists can do in improving and mitigating the impact of air pollution. Like was said earlier in the presentation, air pollution has now been added as a risk factor for non-communicable diseases. So we've already provided a resource to really understand what pharmacists can do in this area. Then we also produce a toolkit on medicines use review to guide pharmacists to implement medicines use review at their clinical practice level. Then in 2021, we had another 2 resources. The first one was on medicines reconciliation to help pharmacists in implementing medicines reconciliation services at their practice level. Then we also had a nutrition and weight management toolkit to help pharmacists to provide services in this area. We know that nutrition, that is unhealthy diet, is also a risk factor for non-communicable diseases. So we've provided this resource to support pharmacists in providing this service. Then again, this year, which is 2020, we're launching a very important project. The title is called the FIP Practice Transformation Program on Non-Communicable Diseases. We've seen and heard about how pharmacists must take a role in ensuring the reduction of non-communicable diseases. Through this program, that's what we aim to do. So from this program, we aim to provide tools and strategic support to FIP member organizations to develop and implement pharmacy services that can have a sustained positive impact in the prevention, screening, management, and treatment optimization of NCDs. We'll be starting this program with a practice transformation program on diabetes, but from next year, we'll have on cancer, on cardiovascular diseases, mental health, and chronic respiratory diseases. So this program will be launched later in the year, so I would advise you to keep an eye on the FIP's events website. And then we've also had a lot of numerous digital events in the areas of non-communicable diseases, in asthma, in diabetes. We've had a lot, so please, we would encourage you to go on the FIP website, events website, and try and be a part of these programs. The overall aim is for us to transform NCD care, which will be in alignment with the SDGs goal 3.4 And then also the fact that at FIP we'll also be organizing a ministers summit in 2023 to kind of really showcase the impact of pharmacists in addressing non-communicable diseases. Thank you so much, and I hope you're a part of everything we're doing.
Thank you so much, Onyeka, for this overview. Yeah, even if some of these resources are already a few years old, they still provide excellent resources and best practices and evidence of the impact of some of these interventions that we've been discussing throughout the event today. So we do encourage you to go back and read these publications and use them in your daily practice. So thank you very much, Onyeka. And now it is my pleasure, and I thank you all for staying on. We are running a little late, but I will just beg you to stay on for a few more minutes, and I will give the floor to my colleague, Chris John, who is the FIP lead for data and intelligence, who will present an activity to engage with you in developing the indicators and the strategies for monitoring and evaluating the implementation and progress on Development Goal 15. So thank you very much, Chris, and the floor is yours.
Hi, everyone. Next slide, please. So the FIP Global Pharmaceutical Observatory, its mission centers around data, intelligence, advocacy, and reporting. Next slide, please. And you'll see the Global Pharmaceutical Observatory's outputs and inferences are listed here on this slide. And the reason we are here today really is because one of the main outputs and inferences is health system strengthening by tracking progress against development goals. And particularly today, we want to look at how we track progress against Development Goal 15. Next slide, please. Current GPO actions are listed here, as well as projects. I'm not going to go through them all in the interests of time, but again, one of the big projects we are undertaking are development goal indicators, tools. So we have a way of monitoring and measuring progress towards the development goals. And this is where you all come in as our audience today, particularly with Development Goal 15. Next slide, please. FIP is now seeking to develop indicators and country-level metrics to measure and monitor progress and the performance of the implementation of the FIP development goals via the FIP Global Pharmaceutical Observatory. So now, as we come to the end of this event, we would like to seek your support for this Global Indicators and Metrics project by contributing to this brief activity linked to the current FIP digital events you have joined. So we would like to hear your opinions about how this development goal today that you've been hearing about from our expert speakers can be monitored and measured. You'll also receive an email to complete this activity after the end of this event if you don't have time to do it now, but it would be great if you can do it now, and you can click on the link on the slide or copy and paste it or scan the QR code. So we're very grateful for your help and expertise in engaging with this very brief 5-minute activity or less, and help us develop the indicators and metrics to measure and monitor progress with this goal. So that's all I had to say because we're running out of time, but thank you so much. If you can have a go at that activity, we would be much appreciated.
Thank you very much, Chris. Yes, we do encourage you to participate in this activity and help FIP develop a set of indicators on how we can monitor progress on DG 15 and the implementation. So thank you very much. As you may understand, for the sake of time, we will not have the opportunity to have a panel discussion, but I believe that the presentations were incredibly clear and very valuable in providing this an overview of the role of pharmacy in terms of practice, science, and workforce development and education in the area of NCDs. Just take the opportunity to remind you that the next episode in this series will focus on Development Goal 6, Leadership Development, and will take place in just a couple of weeks' time on the 21st of July. So stay tuned, and we do encourage you to register for that event. Finally, also, as you may know, on the 25th of September will be World Pharmacists Day. So for this year, we are encouraging you to take part in a global campaign and to ensure that your country is represented in this campaign and our Champions Wall for World Pharmacists Day 2021. So you have this website here that is indicated on the screen, and we encourage you to go there and just follow a few simple steps to create your own graphic like the one that is shown on the screen, and that it will be displayed on this Champions Wall on the FIP website. So again, thank you so much for attending this webinar. Do stay tuned for our events website to learn more about our upcoming events, and we do hope to see you soon at other events organized by FIP. So again, thank you very much to all our speakers and panel members for their excellent contributions, and to you all for attending this webinar. Have a good day or night. Goodbye. Thank you.